We now come to the statement I call the Secretary of State for Health, Victoria Atkins.
Thank you, Mr. Speaker, and with your permission, I would like to make a statement on our plan to recover and reform NHS dentistry. But first, on behalf of the entire House and my department, I would like to send our very best wishes to His Majesty the King. His decision to share his diagnosis will be welcomed by anyone whose life has been touched by cancer. And I know that we're all very much looking forward to seeing him make a speedy recovery and resume his public duties. Turning now to dentistry. Thanks to a once-in-a-generation pandemic between 2020 and 2022, 7 million patients across England did not come forward for appointments with NHS dentists. Since then, we have taken decisive action to recover services. We've made reforms to the dental contract so that practices are paid more fairly for caring for NHS patients with more complex needs. And we've made sure that dentists update the NHS website regularly so the public know that they're taking on new patients. This has delivered results. Over 1 million more people saw an NHS dentist last year than the year before. But we know that too many, particularly those living in rural or coastal communities, are still struggling to find appointments. This recovery plan will put this right by making NHS dental care faster, simpler and fairer for patients and staff. It is built on 3 key pillars, and I'll address each one in turn. First of all, we will help anyone who needs to see an NHS dentist to do so, wherever they live and whatever their background. To do this, we must incentivise dentists across the country to care for more NHS patients. And that is why I'm delighted to tell the House that for the coming year, we are offering dentists 2 new payments on top of their usual payments for care. That will be £15 for every check-up they perform on NHS patients who haven't been seen over the past 2 years, and £50 for every new NHS patient they treat who hasn't been seen over the same period. Because we know that patients who don't have a relationship with a dentist find it harder to get care. This is not a long-term ambition. Our new patient premium will be available from next month. Mr. Speaker, we're also increasing the minimum payment that dentists receive for delivering NHS treatments. This will support practices with the lowest unit of dental activity, or UDA, rates to provide more NHS care. But we know that in many of our rural, remote and isolated communities, dentists themselves are in short supply. And that is why, starting this year, up to 240 dentists will receive Golden Hello payments worth up to £20,000 when they commit themselves to working in one of these areas for at least 3 years. These dentists will give patients the care they need faster, it will make dental provision fairer, and it will tackle health inequalities. And, Mr. Speaker, we're also delivering dentistry to our most remote regions without delay. This year, we will deploy dental vans to more isolated rural and coastal areas. Staffed by NHS dentists, they will offer check-ups and simple treatments like fillings. This model has been a tried and tested success across many regions. For example, last year in Cornwall, a mobile van visited 5 harbours and treated more than 100 fishermen and their families. We will be rolling out up to 15 vans across Devon, Gloucestershire, Somerset, Norfolk, Suffolk, Lincolnshire, Cambridgeshire, Dorset, Cornwall, North Yorkshire and Northamptonshire. This move has been welcomed by Healthwatch, the Nuffield Trust and the College of General Dentistry. And we will let patients know when vans will be in their area so they can get the care they need faster. Mr. Speaker, these reforms will empower NHS dentists to treat more than 1 million people and deliver 2.5 million more appointments. Just as the CEO of National Voices, a group of major health and care charities, has said, this extra money should help thousands of people who have been unable to see a dentist in the last 2 years to get the care they need. And these reforms are just the beginning. This recovery plan will also drive forward reforms to make NHS dentistry sustainable for our children and our grandchildren. Which brings me to the second pillar, growing and upskilling our workforce for the long term. Our long-term workforce plan, the first in NHS history, gives us strong foundations on which to build. By 2031, training places for dentists will increase by 40%, 40%. And places for dental hygienists and therapists who can perform simple tasks such as fillings will also rise by 40%. More dentists and more dental therapists will mean more care for NHS patients. And I'm delighted to tell the House today that we are going further in 3 key ways. First of all, we will consult on a tie-in to NHS work for dentistry graduates, because right now, too many are choosing to deliver private work over valuable NHS care. More than 35,000 dentists in England are registered with the General Dental Council, but last year almost a third worked exclusively in the private sector. Training these dentists is a significant investment for taxpayers, and they rightly expect it to result in the strongest possible NHS care. That's why this spring we will launch a consultation on a tie-in for graduate dentists and how this could deliver more NHS care and better value for taxpayers. Secondly, we will take full advantage of our dental professional skills. Today, even though they have the right training, without written direction from a dentist, dental therapists cannot do things such as administer antibiotics. This year, we will change this, making life simpler for dentists and making care faster for patients. As the President of the College of General Dentistry has said, the use of the full range of skills of all team members will enable the delivery of more care and make NHS dentistry more attractive to dental professionals. Thirdly, we will recruit more international dentists to the NHS. We have a plan to do this by working with the General Dental Council to get more international dentists taking exams, to get them onto the register sooner, and to explore the creation of a new provisional registration status, so that under the supervision of a dentist who's already on the register, highly skilled international dentists can start treating patients sooner rather than working as hygienists while they're waiting to join the register. And turning now to our plan's third pillar, which is prioritising prevention and giving children a healthy smile for life. This begins by supporting parents to give their children the best possible start. That is why family hubs up and down the country will offer parents-to-be expert advice on looking after their baby's teeth and gums. And as they grow up, we will support parents and nurseries to make brushing their teeth part of every child's routine before they start primary school. Because the evidence is clear. The earlier good habits are built, the longer they will last. And seeing a dentist regularly is also vitally important for children's health. Since the pandemic, too many have been unable to do this. And this is why this year we are taking care directly to children. We will deploy mobile dental teams to schools in areas with a shortage of NHS dentists. They will apply preventative fluoride varnish to more than 165,000 reception-age children's teeth, strengthening them early and preventing decay. And Mr. Speaker, our Smile for Life programme has already been endorsed by the College of General Dentistry. Mr. Speaker, 6 million people in England already benefit from water fluoridation. And to go further to protect children's teeth, we will consult on strengthening more of our country's water with fluoride. Again, the evidence is clear. In some of the most deprived parts of England, enhancing fluoride levels could reduce the number of teeth extracted because of decay by up to 56%. That is why, through the Health and Care Act, we've made it simpler to add fluoride to more of our water supply. And as a first step this year, we will launch a consultation to expand water fluoridation across the North East. An expansion that would give 1.6 million more people access to water that strengthens their teeth, preventing tooth decay and tackling inequality. Mr. Speaker, this is our government's plan to recover and reform dental care. Dental training places up 40%, 2.5 million more appointments, dental vans treating more patients, more dentists in remote areas, more dentists taking on NHS patients, better support for families and better care for children, patient access up, inequity coming down, making life simpler and treatment faster and fairer for patients and staff. Mr. Speaker, we've taken the difficult decisions and we have delivered now a long-term plan to make dental care faster, simpler and fairer for people across the country. We're going to get on with the job and put our plan into action. I commend this statement to the House.
Shadow Secretary of State, West Streeting.
Thank you, Mr. Speaker, and can I wholeheartedly associate myself and my party with the remarks of the Secretary of State and sending our best wishes to His Majesty the King, and having gone through a cancer diagnosis myself, particularly his family, for whom it's often more difficult than the person receiving the diagnosis. And in the generous spirit in which we've begun, can I thank the Health Secretary for accidentally emailing me her entire plan yesterday? It was above and beyond the courtesy we normally expect. And in that spirit, I look forward to receiving her party's election manifesto any day now. Of course, we'll have to write ours first to give them some inspiration. Mr. Speaker, after 14 years of Conservative government, NHS dentistry is in decay. 8 in 10 dentists are not taking on new patients. In the southwest of England, the figure is 99%. 1 in 10 people have been forced to attempt DIY dentistry, Dickensian conditions, because they can't see an NHS dentist and they can't afford to go private.
Order. Mr. Beck. No, I'm sorry, but you did a little bit earlier. I don't want any more hattling from you. I want everybody, quite rightly, to listen to the Secretary of State, except the same for the Shadow Secretary of State, West Street.
Oh, don't worry, Mr. Speaker. I'll come back to the PPS shortly. Tooth decay is the #1 reason for children aged 6 to 10 being admitted to hospital. And unbelievably, there have been reports of Ukrainian refugees booking dentist appointments back home and returning for treatment because it is easier to fly to a war-torn country than it is to see an NHS dentist in England. Well, Mr. Speaker, at least there's one government policy that's getting flights off the ground, because it's certainly not their Rwanda scheme failure. And, Mr. Speaker, let's look at the human consequences of this Conservative tragedy. Labour's candidate in Great Yarmouth, Keir Cummins, told me about Jeanette, a young woman in her 30s who has struggled with gum and mouth problems all her life. She used to be able to get treatment. Now she can't find an NHS dentist in all of Norfolk to take her. She can't afford to go private. It hurts to smile. It hurts to laugh. The pain is so great, Jeanette doesn't go out anymore. And just this week, Jeanette resorted to trying to remove her own tooth. This isn't right for anyone of any age, but Jeanette should be in the prime of her life. So will the Secretary of State apologise to Jeanette and the millions like her for what the Conservatives have done to NHS dentistry? After 14 years of neglect, cuts and incompetence, the government has today announced a policy. More appointments, recruiting dentists to the areas most in need, toothbrushing for children. It sounds awfully familiar, Mr. Speaker. By adopting much of Labour's rescue plan for dentistry, doesn't it just show that the Conservatives are out of ideas of their own and they are looking to Labour to fix the mess they have made? And next time Conservative ministers say Labour doesn't have a plan or Labour's plan isn't credible, don't believe a word of it. And of course, Mr. Speaker, there are some differences between our two parties' approaches. Labour is pledging an extra 700,000 extra urgent and emergency appointments, additional to the appointments announced today. Can the Health Secretary confirm that the government's plan doesn't provide any additional emergency support? Labour proposed supervised toothbrushing for early years. Conservative MPs accused it of being nanny state. Does the Health Secretary stand by that label, or does she now support children under 5 being supported to brush their teeth? And, Mr. Speaker, the key difference is this. We recognised our plan was a rescue plan and that to put NHS dentistry back on its feet, immediate reform of the dental contract is needed. Without this, this is a plan that is doomed to fail. And don't just take my word for it. The British Dental Association have said this plan won't stop the exodus of dentists from the NHS, it won't provide a dentist for every patient who needs one, and it won't put an end to this crisis. And coming to the miserable script of the PPS and the whips that's spreading it round the table, if it is really the case that Labour's contract is to blame, then why haven't they reformed it for 14 years, and why aren't they reforming it now? Because, Mr Speaker, in 2010 the Conservatives promised in its election manifesto to reform the dental contract. They're not just bringing back Lord Cameron, they're bringing back his broken promises. And, Mr Speaker, people have been desperately trying to get dental care for years, and there was nothing from the Conservative Party. But now we're in an election year, they're trying to kick the can down the road, scramble for a plan. They only discover their heart when they fear in their heart for their own political futures. And the consequences have been seen around the block in Bristol. Finally, Mr Speaker, the Secretary of State is promising reform after 2025, after the next general election. Who is she trying to kid? After 2025, the Conservatives will be gone. And if they're not, NHS dentistry will be. How many more chances do they expect? How many more broken promises? 2010, 2015, 2017, 2019. Mr Speaker, their time is up, and it's time for Labour to deliver the change this country needs.
Well, Mr Speaker, I tried to help him by giving him an advance copy of my speech yesterday, and yet that's his speech. Mr Speaker, this government is focused on delivering for patients, and perhaps I can just help him understand the difference between their proposals and the government's fully funded dental recovery plan. Their ambitions reach only as far as 700,000 more appointments. Our plan will provide more than 3 times the number of appointments across the country, 2.5 million to help him with his maths. We are offering golden hellos to 240 dentists to work in hard-to-reach and underserved areas. Their proposals cover only 200. They have no plan for training more dentists. Again, we set out in the long-term workforce plan last year, and again in the dental recovery plan, we will increase training places for dentists by 40% by 2031. And then the centrepiece of their proposals, making teachers swap their textbooks for toothbrushes, an idea that is hated by teachers and patronises parents. We believe that most parents do a great job of looking after their children. I know that's something the Labour Party doesn't agree with. The honourable gentleman has called our children short and fat on a media round, but we believe that most parents do a great job, and this is why we are supporting them when mums-to-be are pregnant. We're supporting them in family hubs and in nurseries, and we will not be waiting. We will not be waiting until reception class, by which time, of course, children have already got their teeth. But I do just want to dwell on the experience of anyone living under Welsh Labour, or Labour in Wales, because, of course, the health services in Wales are devolved, and indeed the Leader of the Opposition has called Wales the blueprint for how they will run our health system. Welsh Labour has the highest proportion of NHS dental practices not accepting adult patients, and the joint highest not accepting child patients. In Wales, 93% of NHS dental practices are not accepting adult patients, more than any other nation in the UK. And 86% are not accepting child patients, which is the joint highest with Northern Ireland. And how are they going to pay for all this? We have funded it. It's fully funded. But how is Labour going to pay for it? Well, it's that magical money tree. The list of policies which are funded by the non-dom policy is as long as my arm. In 2022, it was promised to fund a workforce plan. Last September, it became breakfast clubs meals. Then by October, it morphed into 2 million appointments and scanning equipment. And by Christmas, it was funding a dentistry plan. Same old Labour, Mr Speaker. They have no plan.
Out of the House, Sir Peter Bottomley.
Mr Speaker, the House enjoyed the opposition spokesman's words. I'm not sure how many he wrote himself. Some seem rather familiar. if you read Matthew Paris this morning talking about Ukraine to have a filling fixed. Can I say to my right honourable friend that in West Sussex, in Worthing and in Arran, we want to have the same situation you find in parts of London, where dentists have a sign saying new NHS patients welcome. Can I say to her, if she's been working with the British Dental Association and General Dental Council to bring forward registrations, to get incentives right, and to make sure that dentists are no longer told you can't serve any more patients because you go above your limits. Can we confirm we're taking limits off and that dentists, especially the younger ones, can do as much work as they can, helping as many patients as possible, so that we can get back to the situation which we were in before the Labour changed the rules about 20 years ago?
I thank my right honourable friend and say to him that we have focused this plan on introducing this bonus for new patients, the new patient premium, because we think, having discussed this carefully with professionals, that we think that is one of the ways in which we can incentivise people into NHS practice. Already we know that dentists can work up to what's called 104% of their contract. Many do that, some sadly do not, and so we are also trying to encourage those dentists that already have NHS contracts to go that extra mile and use the full slot that is available to them.
Rachael Maskell.
Thank you, Mr. Speaker. The Health Select Committee took months gathering evidence, putting together a recovery plan which the government should have adopted. Dentists wanted that plan put in place, and central to that was reform of the NHS dental contract. However, the Secretary of State has completely failed to even mention reform of that contract, and as a result, dentistry in my constituency in York, where constituents are waiting 7 years to see a dentist, will not see the recovery which she talks about. Why didn't she adopt our plan?
I hope the Honourable Lady will be of the usual help I expect her to be to her constituents in publicising this plan. We are getting graphics and information out to all members of Parliament so they can help their constituents understand what will be available in their local area, because I know each and every one of us want the very best for our constituents. She will be interested, I know, in the new patient premium, which is encouraging NHS dentists back into NHS practice for the first time, and also the increased price in the UDA. Reform of the dental contract is very much part of our agenda, but we realised we need immediate help now for communities such as hers.
Chair of the Select Committee, Steve Brine.
The plan, recovery and reform, is right. The Select Committee will study it carefully. The Dental Minister has already been invited to come before us so that we can talk it through with her to see what it reflects our aforementioned report on the subject. The golden hellos, the toothbrushing for preschoolers, as long as the workforce can handle it, and the mobile vans are good, but even a day longer of the UDA-focused contract is a problem. Can the Secretary of State say how she plans to entice professionals to return to NHS dentistry, as so many have left, because that is key?
Very much so, and it is primarily through the new patient premium. This will mean that from next month, dentists will be able to turn their closed signs to open for NHS patients, because we wanted to use levers that could be deployed immediately in order to help our constituents.
Daisy Cooper.
Thank you, Mr. Speaker. It's estimated that more than 12 million people are waiting for dental treatment, but the government's announcement says they'll help just 1 million. The government's underspend last year was 400 million. It's expected to be the same this year, but only 200 million has been announced. This is a drop in the ocean. Now, in St Albans, my dentists are desperate to provide NHS care, and my constituents are desperate to see a dentist. But at the heart of this is the broken contract. So will the government take up the Liberal Democrat plan to reform the contract and provide guaranteed access to an NHS dentist for everybody needing urgent and emergency care?
I heartily recommend the recovery plan to the Honourable Lady, because it offers 2.5 million more appointments. It has a very long-term ambition for prevention of decay in children, and in addition it has that long-term vision about increasing training places for our dental professionals by 40% by 2031.
Paul Beresford.
Thank you, Mr. Speaker. As you're aware, I have a declared interest in this particular topic. As my right honourable friend is aware, dentistry in England is a seller's market. It's estimated that there are 5,000 dentist vacancies in England. When I came here in the early 70s with my dental degree, like very, very many colleagues from Australia, New Zealand, etc., I presented at the Dental Council, the GDC, who said welcome. They stamped my hand, and I went off and worked on the National Health Service the next day. Now and for decades, the General Dental Council requires graduates from world-class dental schools, every bit as good as the ones we have here, to wait and to pay and to sit what is called an overseas registration exam. Currently, the waiting list for this exam is 2,000 overseas dental graduates, many of them every bit as good as we produce in this country. The GDC could change that overnight. They could accept graduates automatically from known and trusted international schools overnight. Could my right honourable friend please have a small chat to the chairman of the General Dental Council?
Well, may I thank my right honourable friend and recognise the enormous expertise that he brings into the chamber on this. He knows, because he's genuinely been talking to me about this on many occasions, Madam Deputy Speaker, about the important role that the General Dental Council plays to ensure that we get international dentists registered as quickly as possible, and I would be very much looking forward to discussing this with the GDC so that we can get more international dentists onto our register and working in our practices.
Judith Cummins.
Thank you, Madam Deputy Speaker. I welcome much in this plan, which mirrors many of my ideas over the years, and indeed much within Labour's plan. However, with access, the government claims that the recovery plan will deliver care for up to 2.5 million people, but government data also shows that 12 million people in England have unmet needs for dentistry, which leaves around 9.5 million people without an NHS dentist. And this includes my constituent, Beverly Kitson, who has osteoporosis and takes hyaluronic acid as treatment, and the drug has damaged her teeth, and she now requires a check-up every 3 months after 4 of her teeth have decayed to such an extent that they need to be extracted. Now, Beverly has been with the same dentist for 50 years, but she's just been told that it's now going fully private, now leaving her without an NHS dentist. So can the Minister guarantee Beverly that under these plans she'll be able to access an NHS dentist?
So, Madam Deputy Speaker, we have very much tried to ensure that those dentists who already hold NHS contracts keep those contracts and keep working those contracts. This is why we have fallen upon the new patient premium in order to make it more in their financial interest to take on new patients. I appreciate her point about retention. Again, this is something we are looking to address through the increase in the UDA. But of course, we all acknowledge that dentists are independent contractors, and so we must ask them to do their bit, particularly if they're new dental graduates, to do their bit and help our NHS out with this.
Maggie Throup.
Thank you, Speaker. A number of NHS dentists across Erewash have recently retired, leaving a cohort of my constituents without access to NHS dentistry. Unfortunately, the practices find it really difficult to recruit the replacements for retirees. How will today's plan help speed up that recruitment so that my constituents are not without NHS dentistry for much longer?
I thank my honourable friend for all the work that she has done in this department and on this subject. We are taking a long-term vision with training dentists, as I say, through the long-term workforce plan. Last year we set out an ambition to train up to 40% more dentists by 2031. As we begin also the consultation on a tie-in with those graduates, we do believe that we will see, we are confident that we will see a greater supply of dentists to our NHS services.
Paula Hamilton.
Thank you, Madam Deputy Speaker. The 200 million pledged today is less than half of last year's record-breaking underspend. The plan says any underspends will be ring-fenced for dentistry, but the Minister promised that last year, but that did not happen because ICBs were using that underspend. Why should the 73% of dentists in the West Midlands who can't and are not accepting any new patients, believe it will be any different this year? Thank you.
So the Honourable Lady alights upon an important fact that is sometimes lost in this debate, that namely that although an NHS dentist may have an NHS contract, they may not in fact work the whole of that contract. Some NHS dentists very much do so, others work a fraction of it. And so we are trying to encourage dentists who do not use their full contract to do so, because that in itself will bring more patients in. That, alongside the new patient premium, we are confident will help constituents such as her get the treatment they need.
John Redwood.
Wokingham has a fast-growing population based on building a lot of new homes, so as she rolls out her new plans, will she also make sure there are incentives in there to provide dental services on the NHS in areas where population is moving in and needs them?
My right honourable friend raises an interesting point, and indeed it is exactly the sort of discussion that I'm having with my right honourable friend, the Levelling Up Secretary, because having that connected and joined up approach between planning and health is something I'm really interested in, and I think it could draw dividends for us all.
Barbara Keeley.
Thank you, Madam Deputy Speaker. Well, I don't believe what the Secretary of State has described will deal with the complexity of dental problems that are out there. I have a constituent who was referred to the Manchester Dental Hospital for a possible abscess and was told that even an urgent referral would take a month. In fact, the dental hospital didn't get back to her for 5 months after the referral and offered her a telephone consultation. The amount of pain and infection meant that she had to seek private treatment at a cost of £4,000, but many cannot afford that, including the young man wheeled into Bolton Royal Hospital in great pain, leaking blood on the floor after trying to remove her painful teeth with pliers. What does the Health Secretary say to those patients who have long-standing and complex dental problems, who are paying the price for waiting in pain, paying for private treatment, or trying to remove their own teeth?
I'm really keen to urge the Honourable Lady, because I take that constituency case very seriously. In future, if a constituent contacts her with that level of discomfort and pain, she should advise her constituent to contact 111 and, if necessary, go to accident emergency, because the people, they're shaking their heads. What she has just described is a very serious situation. That she needs medical attention, and the NHS is there ready and willing to help. That is the advice she should be giving her constituents, and I hope she takes it as seriously as I do.
The Secretary of State is giving an answer to a question. We don't need all this shouting. People might not agree with the answer, but you have to listen to the answer. Secretary of State. Oh, Secretary of State has finished. Sir John Hayes.
Thank you, Madam Deputy Speaker. In congratulating my right honourable and personal friend on this very welcome, excellent statement, will she forgive the ferocity with which the right honourable member for Gainsborough and I made the case for dentistry when we met her recently? And in that spirit, will she ensure that some of these new dentists do indeed come to rural Lincolnshire, where we desperately need good dental care? She has today, Madam Deputy Speaker, irrigated the dental desert.
A very sincere thanks to my friend, my right honourable friend. The House can imagine the advocacy that I was receiving from both my right honourable friend and my honourable friend for Gainsborough. In terms of reaching rural and coastal areas, as a proud Lincolnshire MP myself, I wanted to bring about a set of plans that will address those underserved areas, and I'm delighted that the plan meets with my right honourable friend's approval.
George Howarth.
Thank you, Madam Deputy Speaker. The Secretary of State will be aware that the crisis in NHS dentistry has been 14 years in the making. She'll also be aware that in Knowsley that it is impossible for anybody today to sign up with an NHS dentist. The measures she's described may over time help meet the problem. But what advice would she give today to those constituents in Knowsley who cannot get an NHS dentist?
The advice and guidance to dentists will be going out today, and the new patient premium that I've already told the House about, that will come in from March. So that it is weeks away.
Therese Coffey.
Thank you, Madam Deputy Speaker, and I thank my right honourable friend, I think, for an excellent statement, an excellent plan. This is exactly what our patients in Suffolk are waiting to hear. The rural payment, the bonus there, and also the mobile service. Now, I'm very conscious that many dentists have chosen to not have more patients, and they might blame the contract this, that or the other. That's why I welcome, though, her plan about potentially tying in graduates to the NHS. My honourable friend for Mill Valley has already referred to the General Dental Council, who, in my view, have not taken full advantage of the regulations that came into force March last year. But also, could she please look at the NHS's own rules, which further restrict the rapid supply of dentists into the NHS for our patients?
Well, may I thank my right honourable friend for all the work that she did in the department on dentistry. I'm very conscious that this is a plan that many people have contributed towards, and I'm grateful to her and others. In terms of the General Dental Council, again, I very much hear those observations and will be ensuring that the GDC hears them as well. And that is a fair challenge to the NHS, and colleagues, I hope, will see that the plan is co-signed by NHS England. They share our ambition to deliver these 2.5 million more appointments and set up the future of NHS dentistry for our country.
Christine Jardy.
Thank you very much, Madam Deputy Speaker. The statement today by the Health Secretary have been listened to with great interest by my constituents in Edinburgh West, who share a lot of the same concerns, face the same difficulty getting NHS dental treatment, and will be looking for the same sort of solution. So I wonder if she could clarify for me, for all those who come to me, will there be Barnett consequentials for this? If there are, would she impress upon the Scottish Government the need to ring-fence the money and actually invest it in dental services? And if not, would she be willing to share with them how she is approaching the problem in the hope that they might actually respond and do something?
I hear the frustration in the right honourable lady's question. It is devolved. It is a matter for the Scottish National Party, as it is, I'm reminded, hopefully in Wales as well. But I would assume that she will continue her usual advocacy on behalf of her constituents, ensuring that the SNP look to see what is happening in England and try to do better for Scotland.
Neil O'Brien.
Madam Deputy Speaker, I really welcome this plan. I really welcome the extra 200 million. I really welcome the new patient bonus, the measures to get dentists into areas that don't have them, the minimum UDA. These are all good things that will help people in Harborough, Oadby and Winchester get a dentist. But can I ask her to press on with two things? First, the move to a proper national funding formula. Dentistry is the only bit of the NHS without a funding formula that disadvantages shire and coastal areas with older populations. Second, the next round of contract reform. The move to Band 2B is working, dentists are using it, but there are patients who are complex, who a capitation-like payment would be much better for, as the BDA pointed out, and I really encourage her to start working on that difficult group so that we can get extra help for them too.
Again, Madam Deputy Speaker, I must thank my honourable friend for all his work. I know how much effort and commitment he has put into these plans, and it shows actually the genuine, the honourable gentleman there is being a little ungracious. My honourable friend shows the united work across government in order to deliver these plans. But Madam Deputy Speaker, I very much take on board his recommendations, his encouragement, and as I say, we see this plan as delivering 2.5 million more appointments for our constituents, but we also, of course, want to look to the long term as well.
Barry Sherman.
Is the Secretary of State aware that Rip Van Winkle fell asleep for 20 years? This government, the Conservative governments, have been asleep for even longer than 20 years as far as dentistry is concerned. Will she now wake up, talk to dentists like Phil Lucett, one of my excellent national health dentists from Huddersfield, who's in the gallery with his wife today, and talk to real working dentists and get something done about this crisis, which in Huddersfield, in every town in this country, Bristol we saw yesterday, is a crisis. People are in pain, people are suffering, and for 14 years, her government has done little about it.
Well, Madam Deputy Speaker, I must admit I didn't quite know where that question was going, but I think the honourable gentleman is urging me to speak to dentists. I'm delighted to reassure him that my ministerial team and my officials and I, of course, we speak to dentists. In fact, only today I was in a practice in the heart of Westminster speaking to a dental manager who was welcoming this plan, and I'm going to veer away and resist the temptation to comment on Rip Van Winkle.
Peter Gibson.
Madam Deputy Speaker, can I welcome this dental recovery plan which will help deliver dentistry in Darlington? Can my right honourable friend provide me with advice on what more I can do to get my ICB to get on with the commissioning at Firthmoor Community Centre, which lost its dentist practice 10 months ago? And in looking to expand the number of dental training places, can I urge her to look at Teesside University, who have ambitions to build on their existing dental technology provision and train Tees Valley's dentists of tomorrow?
Well, thanks to the work of my honourable friend and others, the Tees Valley, of course, is a powerhouse of growth industries, as exemplified by the Chancellor in his budget and autumn statements recently. I will very much take away his words of advice about his university, but also on the point about encouraging ICBs to take part of this. This is a joint document with NHS England. The expectation will be on ICBs that they deliver this plan, because ICBs exist to look after our constituents, and this plan is one of the ways in which we will be able to secure that help.
Thank
you so much, Madam Deputy Speaker. Bedford and Kempston, like many other areas in the country, we have dental crises. I have raised this matter of dentistry previously, including a Westminster Hall debate. There can be no question that under this Conservative government, there is a crisis in dentistry, and the people of this country have been failed. Why is the Health Secretary refusing to admit that 14 years of neglect and underspending have led us to this?
Says the script. I assume the honourable gentleman will welcome the 2.5 million more appointments that this dental recovery plan will deliver for all our country.
Yes. Heather Wheeler. Can I thank my right honourable friend for this brilliant statement today, and all the team for the huge amount of hard work. Yesterday, or today is dentist day. Yesterday for me was dentist day. I had an appointment with the Minister, and I had an appointment with a real dentist from South Derbyshire. So this news is absolutely superb. Please get them to move to South Derbyshire and more free NHS dentists in South Derbyshire.
Yeah. I've no doubt, with my honourable friend's characteristic joy and irresistible force of nature, she herself will be an advert for dentists to come to work in her constituency.
Dame Diana Johnson.
Madam Deputy Speaker, a constituent recently told me when she was trying to register members of her family with the NHS dentist, she was told there was an 8-year wait to be able to actually access an NHS dentist. On that basis, we know the workforce is a really big issue. We have an excellent Hull and York Medical School. I wonder if the Secretary of State would meet with me and a cross-party group of members of Parliament to talk about how we could develop a dental school at the Hull York Medical School site to actually grow our own dentists for the future.
Well, the Honourable Lady will know that part of the focus of the long-term workforce plan is very much behind the idea of training people in the areas where they're most needed, so I will happily arrange for her to meet the relevant minister. But on this point about registration, the current system is not like a GP practice where a family is registered and they are the only GP you can go to. The whole reason we have been encouraging dentists to update their details on the NHS website is precisely because people can move around to visit different dentists to get the treatment they need. And of course, the plan today will help very much turbocharge those efforts.
Peter Aldous.
Thank you very much, Madam Deputy Speaker. I welcome this recovery plan, which provides the foundation for putting NHS dentistry on sustainable long-term footing. But can I urge my right honourable friend to continue her negotiations to replace the existing NHS dentistry contract as soon as possible, and to provide funding to the Norfolk and Waveney Integrated Care Board so that the University of Suffolk can open a new treatment and training facility in our area to replicate the innovative service that they are about to open in Ipswich.
Well, I very much understand my honourable friend's question, and also commend him actually for the work that he does to try and ensure that his constituents receive the care and help that they deserve. In terms of training, I hope he has drawn out from the plan the emphasis that we are putting on the long-term ambitions of this plan, because we absolutely understand we need to train more dentists, we need to get internationally trained dentists registered and into our system, and of course recognising the critical role that dental hygienists and therapists can play as well.
Clive Bradford.
Thank you, Madam Deputy Speaker. If the Tories cared about the NHS, we wouldn't have 7.6 million people on the NHS waiting list, and we wouldn't have dentistry in crisis. Now, the answer that she gave to my honourable friend for Worsley and Eccles South really demonstrates why we're in this situation. It's not when people turn up at the A&E, it's that inability to access dentist services, NHS dentist services, that ends up people being in that crisis situation, needing emergency care. So can she say, after 14 years of a Tory government, why it is we need a recovery plan for dentistry?
The honourable gentleman was obviously asleep at the beginning of my statement, because I set out what I hope is a fact that agreed across the House about the pandemic. The real problem, people who had a relationship with a dentist before the pandemic are not facing quite the same pressures that people who may have moved home, who may have, their dentist may have moved their practices. They are the cohort of people that we are trying to deal. And it really would help if Labour focused their arguments a little bit more on the facts rather than the scripts that their whips have given out.
Andrew Lewer.
Madam Deputy Speaker, I very much welcome this statement and the previous meetings I've had with my right honourable friend and neighbour, your fellow Minister, member for South North Hants. In your statement, you say that Northamptonshire will be included as part of a dental van rollout, which is welcome, but some of the rest of the statement had a very rural focus with that. You'll recall in my Prime Minister's question that I've focused upon Duston and the shortage there is there. Is it at least a possibility that these vans will be able to go to suburban areas as well as rural ones?
Thank you to my honourable friend. Yes, the way in the criteria that have been applied or will be applied to the transportation and the areas covered by these vans are very clearly set on dental need and other factors such as distance from an NHS dental practice. But we have been able to identify these areas of particular need, and of course we want to get that help to them as quickly as we possibly can through the dental van initiative and the other details in the plan.
Debbie Abrams.
Thank you, Madam Deputy Speaker. Last year, just about half of my Oldham constituent were able to access dental services, well below the pre-pandemic levels. So with these plans, what proportion of my constituents can now hope to access NHS dental services within the next 6 months?
Well, the dental recovery plan sets out immediate term, medium term and long term plans. In the immediate term, we have the new patient premium that will be live from next month. We have the increase in the UDA value for up to £28, and of course the golden hellos that I've already described to those parts of the country that are underserved. There are a batch of measures throughout this plan to try and address the concerns I know that colleagues have across the House.
Paul Bristow.
Indeed, Madam Deputy Speaker. I have a plan to open brand new NHS dentists in Peterborough. New financial incentives, increased UDA rates and recruitment of overseas dentists to Peterborough are all part of that plan. But will my right honourable friend meet with me and those who want to open new NHS dental clinics in Peterborough so we can see that her excellent plan, that Peterborough takes advantage of every part of it?
Well, may I commend my honourable friend on his excellent work as a constituency MP. It is exactly that sort of drive and ambition that will deliver results for his constituents. I would be delighted to meet him to discuss his plans, and I'm pleased that our national dental recovery plan will fit very well with his own local delivery plan.
Jonathan Edwards.
Diolch yn fawr iawn, Madam Deputy Speaker. I regret to inform the House that the situation in West Wales is quite catastrophic, and recent reforms by the Welsh Government have probably made matters far worse. However, what I would like to know, and my constituents, is how much of what she has announced today is new money, resulting in banished consequences for the Welsh Government.
The honourable gentleman articulates the case against Labour-run Wales with great power, I think. In terms of money, this is 200 million additional money on top of the £3 billion that we already spend on NHS dentistry in England.
Siobhan Bailey.
Speaker, now I've raised dentistry a lot because Stroud constituents and dentists have been really worried about this, so I really welcome the government's plans with NHS England. Now I give credit to Gloucestershire's ICB, who recognise the complexity of this issue, and post-pandemic they set about raising provision themselves. We've got some decent take-up so far. Now I plead to the Secretary of State and the Ministerial to continue their relentless drive on focusing and prioritising children's appointments and not let parents off the hook, because we can all do better, even if it's hard to get a toothbrush in your 3-year-old's gob when you're doing that every night. So it's hard. But will she say more about how ICBs are going to get support to deliver these plans and integrate the work that they're already doing, because local areas that are prioritising this are making a difference?
May I thank my honourable friend, and I think she was probably summing up this morning's toothbrush ahead of the school run for many mums and dads up and down the country. And actually that's the point. We want to work with parents. We don't want to patronise them. The overwhelming majority of parents do a great job looking after their kids' teeth. And our plans are to support those who are struggling. But in terms of the expectation on ICBs, again, this is clear. It's an NHSE document. With us, we want to deliver this at local level, and expectations will be set on ICBs to make sure that they fulfil the potential of this great plan.
Justin Matters.
Thank you, Madam Deputy Speaker. I welcome this long overdue focus on dental access. Particularly interested to see the 240 golden hollows that will be available. I think that's clearly going to be inadequate to deal with the scale of the challenge. I'm also concerned that the focus in the statement seems to be on putting those in rural areas. I think there needs to be visibility and transparency on where those golden hollows are allocated, because places like Ellesmere Port have exactly the same issues as other areas in the country. And we get phone calls every week from constituents asking where they can go to see an NHS dentist. We're not able to send them anywhere at the moment. Will she be able to guarantee that in future we will be able to send them somewhere?
Well, I hope the honourable gentleman will be publicising the new patient premium, because that is one of the levers through which we will unlock these places for new patients. And I remember he's taken an interest in this, in fairness. I very much understand the point about location. We have set very strict criteria on how, for example, dental vans can be deployed, but the new patient premium is across the country. We want as many people as possible to be seeing NHS dentists and fulfilling that 2.5 million more appointments.
Martin Vickers.
Madam Deputy Speaker, I particularly welcome the initiative that will improve services in coastal and rural areas, but the Health Secretary and I are constituency neighbours, and she will know the complexities of delivering local services in what we know as Greater Lincolnshire, because of her constituencies in the East Midlands. Mine next door is in Yorkshire and Humber. Can she guarantee that the whole of what we know as Greater Lincolnshire, from the south of the county up to Barton on the Humber estuary, will receive the benefits of the new proposals?
Well, I'm delighted to inform my friend and neighbour that because the new patient premium applies across England, and of course people can move to the dental practice that can offer them the services they need, and so I trust that his constituents will be as happy as mine.
Hal Williams.
Deputy Speaker, is the £200 million additional in the sense of being diverted from other parts of the NHS in England, or is it actually new money from the Treasury which would attract a ban that's consequential for Wales, Scotland and Northern Ireland? Which one is it?
We have finite resources. I've said it's additional money. It is because we have looked at across the board. I've prioritised dentistry, but this is £200 million of additional money in addition to the £3 billion we spend in England.
Jeremy Wright.
Thank you very much, Madam Deputy Speaker. Can I welcome what my right honourable friend has said? And I understand why some of the new resource she's announced is directed at particular types of intervention and at particular groups of patients. But would she agree that one of the downsides, potentially at least, of such an approach is some extra administration that will obstruct dentists in delivering that resource effectively? And will she make sure that that is easy to access funding and that there isn't extra administration that makes that more difficult? And will she also accept that longevity and consistency of funding matters so that dentists can plan properly for their patients?
I'm very grateful to my right honourable friend. My ethos for our NHS and our social care system is to make it faster, simpler and fairer. That is not just for patients, that's also for practitioners, and so we will not want bureaucracy getting in the way of delivering these services. I am impatient to get these services running in people's constituencies, and so we will very much be ensuring that we make it as easy as possible for dental practices to use these services.
Alistair Strathern.
Thank you, Madam Deputy Speaker. I'm sure fellow former teachers here today will have similar memories of the disappointment they felt when, after repeated delays and excuses, a student finally handed in some work, only for it to turn out not just to be a copy of someone else's work, but a pretty poor one at that. While after so much delay and uncertainty, dentistry is at breaking point, any progress, however late, has to be welcomed. But every local professional I've met with has stressed the need for fundamental reform of the contract to get things done. With 14 years of this Tory government now in place, why won't the Minister commit to finally reforming the contract and providing the boost to dentistry that my constituents so desperately want to see?
I think it's very courageous for any Labour Member of Parliament to talk about education, because we know just how dire the educational results are in Labour-run Wales. But in terms of the dentistry plan today, yes, I have committed to reform of the dental contract, and we will deliver these services immediately, because we want to deliver results for his constituents as well as ours.
Selene Saxby.
Thank you, Madam Deputy Speaker, and can I thank my right honourable friend for securing this vital plan, and to thank her team for their ongoing engagement over what has been a difficult issue in North Devon long before the pandemic. I cannot wait to see a dental van in South Molton and Ilford and to welcome new dentists to Barnstable and Braunton and beyond. But I recognise this will take time, and we have recruitment challenges despite our staggeringly beautiful surf beaches, which stretch way beyond her department. I wonder if, given her success in securing today's announcement, whether she may be able to help me promoting these new dentistry opportunities to attract dentists who may not have previously considered spectacular, if remote, North Devon to be their future.
Exactly right, and my honourable friend is a wonderful, wonderful constituency MP, speaking up for her constituents. I can promise her constituents she has been talking to me about from the very moment I was appointed, Madam Deputy Speaker. But in terms of advertising it, this really is I think the opportunity for members across the House. And I do hope that the other side will be gracious and ensure that their constituents are aware of these new services, because we all want the best for our constituents, and the more we can encourage local dentists to take up the new patient premiums, the new UDAs, as well as the Golden Hellos, we will all see benefits in our constituents.
Imran Hussain.
Thank you, Madam Deputy Speaker. For nearly a decade, I have stood in this chamber and told numerous ministers that there's more chance of finding gold bricks on the streets of Bradford than there is a NHS dentist when you need one. And frankly, for 14 years, ministers opposite have made a political choice to ignore our calls. Now, suddenly, in the general election year, the government wants to take part of Labour's plan and present it as their own. Frankly, shameless. Will the Minister at least accept that unless there is a proper reform, our NHS dentistry will remain rotten to the core?
Well, again, a very loud performance from the honourable gentleman, a typically loud performance. If only it were quite as factual as it is loud. I've already set out in my response to his shadow frontbencher the difference between our plan, our fully funded plan, to secure immediate and long-term changes to dental recoveries. After 14 years of opposition, is this it?
James Sunderland.
Health Secretary will recall that we recently met to discuss dentistry in Bracknell, so I really welcome her plan today. Could she please confirm for the House, for the sake of absolute clarity, that a cornerstone of the recovery plan will be for patients to get quicker and easier access to NHS dentists, and also that dentists will be properly incentivised to absorb all of those who need support?
Very much so, and it was a pleasure to meet my honourable friend to discuss the issues facing his constituents. I hope he sees in the recovery plan we very much have those aims in mind in the delivery of the plan, and we will begin to see the rollout of those 2.5 million more appointments in the coming weeks as the new patient premium takes hold.
Richard Bergen.
Thank you, Madam Deputy Speaker. Last year, Health Watch Leeds submitted evidence to the Health and Social Care Committee, testimonies from people at the sharp end of the NHS crisis. One testimony said, "I'm really struggling to find an NHS dentist that is accepting new patients at the moment. I'm an apprentice and get paid the minimum wage and cannot afford a private dentist." Another spoke of how having no access to treatment is impacting on their general well-being and mental health, saying, "I just don't know what to do, who to turn to, how to get help. I just want to be able to smile again." Isn't it the case, Madam Deputy Speaker, that this government's plan is too little too late, and that the queues snaking around dentist surgeries are testimony to the failure of 14 years of Conservative government and a deliberate undermining of our valuable public services?
Well, the honourable gentleman has quoted Health Watch. I presume he also is gracious enough to acknowledge that the move in relation to 15 dental vans has in fact been welcomed by Health Watch.
Bob Seeley.
We need more NHS dentistry on the Isle of Wight, and I welcome this recovery plan, but can the Secretary of State tell me by when will my constituents see the benefits of this plan?
March the 1st. That is when the new patient premium comes into force. There are other aspects that will take a little bit longer, but we're very clear as to the immediate term and benefits. We want to get those out as quickly as possible.
Richard Ford.
Deputy Speaker, in Devon and Cornwall last year, 57% of dental surgeries had at least one vacancy. And before 2016, over 500 dentists registered in the UK had trained in European countries. They made up a quarter of the workforce. Will she heed the call by the Association of Dental Groups to make it easier for qualified European dentists to practice here in the UK?
That is exactly what we're doing, but not just in relation to other European nations, also in relation to other countries around the world. We want the General Dental Council to ensure that qualified dentists from overseas are recognised, that they are supported and they get onto our registers as quickly as possible.
Julian Sturdy.
Thank you, Madam Deputy Speaker. I, like many, very much welcome this recovery plan, and I also thank the Minister for meeting with me earlier on to discuss the issues we faced in York. But can I push the Secretary of State on ICBs and make sure they are held to account on this? Will they face increased monitoring to make sure they spend the allocated money actually on dentistry and on the target areas in this recovery plan? And will that money stay ring-fenced?
May I thank my honourable friend? I very much understand why he asks that question. I know actually it's a concern that other colleagues have raised as well. We are exploring ways in which we can make the expenditure of the dentistry budget more transparent, because it is right that ICBs reflect the needs of their local residents and deliver the services that should be available under this dental recovery plan.
Tom Hunt.
Speaker, I very much welcome these interventions. Particularly just a few weeks ago I raised a PMQ about the tie-in period, so I'm particularly pleased to see that. On the international dentistry, I completely agree with what many colleagues have said. I mean, I've got a close friend of mine whose husband is Mexican and fully qualified as a dentist, and the period between him getting a right to be in the UK and to be a dentist in the UK is about 2 or 3 years. It's far too long, it's far too much bureaucracy. In terms of the therapists, I appreciate that. We've got 24 new at Suffolk in the new course, but 400 applied. So I think there's probably a room for even more therapists to play a key role. Finally, can we make sure that the consultation period for this tie-in period is rapid? It is a common sense policy, which I think we should just get on with. And also, finally, will the Secretary of State visit Ipswich to see the new dental centre and also hear the case we're making for a dental school? We're the obvious place in the east of England. Now we've got a dental centre.
My honourable friend will appreciate I get a lot of invitations. I will do everything I can to meet him. But also, actually, you know, his passion, his ambition for his local area, his constituency shines through, not just in the questions he asked today, but at the PMQ he raised weeks ago. He is absolutely right. We need the General Dental Council, and I think they will work with us to ensure that we can get more international dentists registered as quickly as possible for the benefit of our constituents.
Andy Carter.
Indeed, Madam Deputy Speaker, and can I welcome what the Secretary of State has said today. Can I also pay tribute to the ICB in Cheshire for the work that they've done to put additional appointments into Warrington, where it's been incredibly difficult to find NHS dentistry. Despite there being many dentists on the high street, so many have decided to move away from NHS dentistry. So can she explain how these changes and announcements today will incentivise dentists to go back to providing NHS services so that constituents in Warrington South can actually get the NHS appointment that they so readily want?
Very much so, and I thank my honourable friend for his question. We recognise, as I've said before, we know that obviously dentists are independent contractors. We want to encourage them back into the NHS if they have left it, and we believe that the new patient premium and the work on the UDA are just two of the levers that we can deploy in order to achieve this. But we also have a longer-term vision for our NHS because through the long-term workforce plan, we will be training 40% more dentists by 2031. That's real ambition and a plan for the long-term future of our country.
Anna Firth.
Thank you very much, Madam Deputy Speaker. I completely welcome this plan. I particularly welcome my right honourable and learned friend's focus on underserved areas and coastal communities. Something I've raised before in the Chamber. Southend is a coastal city with over 180,000 residents and only 3 dentists currently accepting NHS patients. So we qualify on both counts. Please could she confirm for Southend and Lee residents that we will also get either a van or better dental care, preferably within months, not years?
I'm delighted to tell my honourable friend that those dental surgeries already operating under NHS contracts will have the benefit of new patient premiums and the increased rate of UDA. In terms of the dental vans, she'll appreciate that we're having to apply very strict criteria to this, but I am delighted to see how enthusiastic she is about this recovery plan.
Holly Mumby-Croft.
Thank you, Madam Deputy Speaker, and can I thank my honourable friend for this really welcome plan. Can she give advice to patients? For those who are registered with an NHS dentist, haven't been seen in the last 2 years, should they contact their dentist if they want to get an appointment, or should they wait to be contacted? For those who aren't registered, where will they find a list of dentists that they can contact and make their interest known in becoming their patient?
Well, I thank my honourable friend and fellow Greater Lincolnshire MP. In terms of the mechanics of this being delivered, the new patient premiums will come into force. Already, patients should look at the NHS website to see which practices have places available in their area. They can go there. They do not have to have had an existing relationship with that dental practice. And we will also be setting out for constituents, for members of Parliament, how once the new premium comes in, how people can get in contact and get those appointments we all want them to get.
Ben Everett.
Deputy Speaker, more dentists, more appointments, more incentives for NHS work and a focus on underserved areas. This is exactly what Milton Keynes needs. So I'd like to thank the Secretary of State and in particular her Dental Minister and my constituency neighbour for all the work they put in particularly listening to me banging on about dentistry in Milton Keynes for so long. I just have one more clarification, please. The mobile dentist vans, will they be serving hard-to-reach rural areas like my beautiful market towns and villages in Milton Keynes North?
Well, may I thank my honourable friend, and I join in his praise for my right honourable friend, the Dental Minister. In terms of dental vans, as I say, there are strict criteria we're having to apply to these. We have wanted to get them out as quickly as possible to those most underserved areas. But of course, this is we don't want dental vans to be the limit of our ambitions. The idea behind them is to very much revitalise those parts of the country that do not have NHS dental practices within reasonable distance at the moment, and we're convinced that dental vans is just one of the levers through which we will achieve this.
Matt Vickers.
Thank you, Madam Deputy Speaker. As my right honourable friend knows, I'm extremely concerned about access to dentistry for residents in Stockton South, so hugely welcome this unprecedented investment and the places it will create locally. Can my right honourable friend confirm that the government's committed to tackling this situation both as quickly as possible, but also for the long term, and will continue to consult on broader workforce and contract reform.
I'm delighted to confirm that for my honourable friend, and we've wanted to deal with the issues as quickly as we can, but also with an eye to the future. This is the way in which the government sets out our plans for the NHS and for our social care system, and I'm confident that through, for example, the introductions of golden hellos for new dentists, we know that it works with GPs. We want to try this now with dentists to see if we can get dentists into those areas that don't have the service they need at the moment.
James Wild.
Thank you, Madam Deputy Speaker. According to the National Audit Office, North West Norfolk has one of the lowest number of dentists per population. So can my right honourable friend confirm that my constituents will benefit from the £20,000 incentives from the dental vans and mobile dental vans? And on training, will she look closely at the proposal from the University of East Anglia for a dental training school, the obvious place to have it in the east of England?
Well, my honourable friend...
Secretary of State, I was going to let her answer. I kept thinking we're near the end. Secretary of State.
Thank you. Thank you, Madam Deputy Speaker. In terms of my honourable friend, he'll not be surprised to learn I've been receiving rather a lot of lobbying about the location of future dental schools, but and he will see in the plan itself that we are very open to the idea of training people with a view to them then remaining in those areas. Again, this is where golden hellos come in, and they will most definitely apply in the hardest to reach and underserved areas. And as I say, with dental vans, we're taking very careful, criteria-driven decisions about where these vans will be supplied, but we do understand the problem that Norfolk has.
And now, Andrew Jones.
Thank you very much, Madam Deputy Speaker. May I welcome this statement and also thank my right honourable friend for meeting with me recently to discuss dental care in Harrogate and Knaresborough, where we've seen two practices hand back their NHS contracts recently, causing significant patient concern. So I was very pleased to hear her comments earlier about the retention of dentists within the NHS. But does she agree with me that good oral health is a critical part of good overall health, and that establishing best practice early in life is essential, and that means about the very earliest of years and supporting parents?
Very much so, and I thank my honourable friend for his question. You know, the truth is that teeth they appear long before reception class, and this is why we want to focus not just on babies and toddlers in early year settings, but also importantly pregnant mums, because their oral health can have ramifications for baby when she is pregnant. And so through this long-term sweep from the very beginning of life to adulthood, this is what the Dental Recovery Plan is seeking to address, with 2.5 million more appointments and a long-term plan for NHS dentistry in our country.
Thank you. I thank the Secretary of State for answering for more than an hour. We now proceed, but first I'll take points of order.